My name is Matthew Sidnor, and I'll be doing my final project on schizophrenia. And schizophrenia is a chronic, debilitating disorder that touches every facet of the affected person's life. People with schizophrenia become increasingly disengaged from society. They fail to function in their expected roles: student, worker, spouse, parent, and their family communities grow intolerant of their deviant behavior, and it affects every area of their life. No matter what they do, is once you have this disorder, you normal functions is not the same. Now DSM-5, there's a set of criteria. Anybody just can't get it, and you have to have for 6 months and at least a full month of some active symptoms, two or more of the following symptoms or criteria. You have to have delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms as well. And the two of those have to be at least either delusions or hallucinations. Another criteria is just these symptoms continue. It's not just sporadic. It's at least 6 months of this. And not only that, but like I stated earlier, a month of continuous. Now, the next criteria is just for a decent amount of time since the beginning, your functions are down. You can't function in regular life as you used to. The next set is schizoaffective disorders must be ruled out. There can't be no other reason for this. It has to be, this is schizophrenia. So depressive or bipolar disorder, psychotic features, that needs to be ruled out. Another set of criteria is it can't be drug or alcohol induced. Completely sober, you are still dealing with these same symptoms. And the last criteria is that there's a history of autism spectrum or communication disorder since the beginning of childhood. That the diagnosis, you can only be diagnosed with schizophrenia if your delusions, hallucinations are just that severe. Now we have your symptoms, and people diagnosed with schizophrenia deal with episodes that make it difficult to distinguish, if this is real or if this is fake. And not taking medication or using any kind of drugs is going to, not taking medication and using alcohol or drugs are going to increase your symptoms. And your symptoms are going to be positive symptoms, negative symptoms, and disorganized symptoms. Now, your positive symptoms, it sounds good, but it's not. It just means that pretty much refers to symptoms that are actively present. And these are your hallucinations, delusions, paranoia, distorted perceptions, beliefs, and behavior. Now we have your negative symptoms, which is the opposite, is broadly defined as a reduction of normal function. So the other one is things that are actively happening. These symptoms are the absent of, and that's the absent of emotion, the amount of words you speak are less, you're not as goal-oriented as you used to be, there's no motivation, you don't interact socially, lack of pleasure, and those are your negative symptoms. Now your disorganized symptoms, that refers to your movements, thoughts, speech, you acting childish, but it's confused and disorganized thinking, trouble with logical thinking, bizarre behavior, abnormal movements. And all of these symptoms, there's ways to treat them. So how do we treat schizophrenia? And schizophrenia, there is no cure. There is no cure, and it's a very serious mental illness. And it affects your thinking, emotions, relationships, decision makings, and medication, psychotherapy, psychosocial therapy. All of the things are ways to improve managing, not curing, but managing this illness. Now your antipsychotic medications, that's mandatory. If you have schizophrenia, you need to be taking this. And this blocks the dopamine receptors in the brain, and it slows down your hallucinations, your delusions. It puts a hold on it. And your first generation medication, those are the ones that are most common. And your second generation ones, those were brought in to get rid of some of those side effects, like tardive dyskinesia and just abnormal muscle movement. And nobody wants to deal with your body moving the whole time you're doing it. Now you have your psychotherapy, and that's where you're talking about your understanding how to manage your symptoms, what's going on with you, how can I get some practical and emotional support. That's your individual psychotherapy, cognitive behavior, cognitive enhancement therapy, and that's you coming to grips with what's going on with you, talking through that. And your psychosocial therapy. Now, your medication is doing good. Your psychotherapy is doing good. Now, how do I get back into this real world? How do I be a functioning member, a productive member of society? And these deal with your social skills, your rehabilitation, your coordinated specialty care. Now, how can I get back into the world? Now, there are some famous people with it, and I was going to do this on Daryl Hammond, a Saturday Night Live actor, but with Christmas movies going on, my family was watching Jingle All the Way, and I thought about Jake Lloyd, and he deals with paranoid schizophrenia. Now, he was Anakin Skywalker in the first, well, not the first Star Wars, but Episode 1, and just the bad reviews from that movie. The actor who played Jar Jar Binks, considered committing suicide, and Jake Lloyd. Pretty much all these actors got bullied. And if you weren't the top A-list actors, how do you handle this? And him being 9 years old, he really couldn't handle it. And his mother came out and said that he's been diagnosed with paranoid schizophrenia, and his symptoms pretty much he doesn't know. It causes a lack of insight into his illness, so he's not aware of what's going on. Now, our biblical references, of course, there's many references in there about demons being released or exorcised out of somebody, people being healed. Paul healing the slave girl when the men were using her, Jesus casting out demons. But then we have two references that I can think of: schizophrenia, Saul and King Nebuchadnezzar. Now, of course, Saul, he continuously disobeyed God and just the rebellious attitude. Yes, he was trying to follow God, but he wanted to follow people. He wanted to make them happy, to appease them. And that continued disobedience led him, God sent the spirit to torment him. Now, David was there to help, alleviate those problems, but it never went away. It continually was the cause of his death because of his erratic behavior consistently. And King Nebuchadnezzar, he thought he was an animal. So just as James says, a double-minded man is unstable in all his ways. Two minds having going here one way, there's no way for you to be stable. And schizophrenia is a very, very serious illness, and for those who manage it, they get my applause. I can't imagine having to deal with that, and I wish them well.